All right, Mr. Hill, I have just a few questions for you about the TENS unit system that you use.
Okay.
Just going to ask you how long you've been using it, when you hear about it, and just
Yeah.
different things like that. So could you briefly describe how the TENS unit works?
The 10 units that I have right now, how I use it is, of course, when I have a low back pain, and what my wife applies the four probe what we call the probes, and they're attached to it can be attached to the back, the lower back, or a combination of two. And she applies them, and I have the unit with me, and it's about the size of a telephone, a portable telephone, and or a cellular telephone, and I can adjust the pain of the from 1 to 10. So it depends on my pain for level that day. I can adjust it from 1 to 10, and it really is it's really neat to have because it's mobile and I can travel with it as well.
Okay. All right, so what condition do you have that requires you to use the TENS unit?
I have a condition that is arthritis of the connective tissues, and what that does is it makes my muscles spasm uncontrollably at times, and I also have arthritis of the spine. So when I use it is when I have flare-ups or when I have what I call a crisis, when my back is really hurt or the spasm. Then I have my wife attach the TENS unit with the leads on them, and I can just self-regulate as far as the magnitude from 1 to 10. 10, of course, being the greatest, and I can attach them as many times as I want.
Okay. And so when did you first hear about the TENS unit system?
Yeah, it was about 25 years ago. I was at a nursing home, and I seen a resident using a TENS unit, and I inquired about it, and the nurse was able to tell me that they were using this device called a TENS unit because it was non-medication, and it seems to give the patients or the client relief in pain and or comfort. And I thought it was kind of a neat device, and I had no idea at that time that I would have one or need for one some 10 years later.
Okay. And so when did you first start using it?
Approximately 15 years ago, and of course, I had injuries to my back, and then, of course, I found to have arthritis of the connective tissues, and this is one of the ways that my wife and I approached the doctor with, in order to not use as much medication, because my system won't allow me to use some opiates and narcotics and things like that. This has been able to give me some relief.
Okay. All right, and so how often do you use it per week?
I use it between 3 to 4 times a week. It depends on the type of situation going on. If I'm having a real bad flare up or spasms, then I just simply have my wife attach them, and I've used it up to 3 times a day, but primarily it's 3 to 4 times a week.
Okay. All right, and do you have any concerns before using it?
Not really. The one concern that I had, of course, having never used it, was if you use an electrical pulse, will it hurt? And I found out that was just nothing that I need to be concerned about. It's regulated. You control the setting, and so there was no need for me to even worry about that.
Okay. All right. All right, and so what are some positive effects of its use?
I think one of the positive effects of it is that for me, it does give relief. And two, I don't have to use, it has reduced the medication that I would use. So if I was using pain medication, I have found out, my wife had found out that by using this device, I can cut down on the amount that I use because I do have a chronic condition. So by using this, plus it is mobile, if there's a need to travel, we can always take it with us because it's controlled by a 9-volt battery. And you can apply it without harming yourself. So she can apply it, and there really isn't no need for me to concern myself with injuring myself.
Okay. Are there any negative effects of using it?
Not that I can think of. Having used it for a number of years now, I really can't think of any.
Okay. And why would you choose this over other similar medical procedures? You have heat, massages. Like, does this help better than those things?
I think it does. I think you can use it in combination with the one that you mentioned with the heat and the massage. I like this because um, it's really simple to apply. It appears that it gives me the best results of the others, whether it be heat or massage. And I like it for the fact because you can actually feel the electrical impulse, and you can control it. So you don't have to worry about getting burned. Like, say, for example, if you were to use a heat compress or things like that, and it's very simple to use. It's very easy to regulate, and of course, it's very, in my opinion, very safe to use.
All right, and why would you recommend this to someone else?
I think I would recommend this to someone because I think it's very effective. I think that it's ease of use, and I think that it is a way of to use a device, a medical device, that would help a patient without the need of medication. And this is something that the patient themselves can control. The amount of that is needed with the control instruments on the panel, 1 to 10. If a patient is having a really bad day, they can go all the way up to 10, which is rarely ever used. But you control it. You control the amount of treatment that you're getting, and I like that part about it.
Okay. I think that's all the questions I have for you. Thank you for your time.
Thank you, sir.